This lecture is about trauma and stressor-related disorders. By the end of this lecture, you should be able to answer the following questions. What are the various types of trauma and stressor-related disorders? What are the symptoms of post-traumatic stress disorder, also known as PTSD? And who is at risk for developing PTSD? There are several sorts of trauma or stressor-related disorders defined by the DSM-5, which include the following: post-traumatic stress disorder, reactive attachment disorder, disinhibited social engagement disorder, acute stress disorder, and adjustment disorders. In this lecture, we'll be focusing primarily on post-traumatic stress disorder. Post-traumatic stress disorder is characterized by intense fear, helplessness, or horror, and in children this would manifest as disorganized or agitated behavior, resulting from the experience of, witnessing of, or hearing about an extremely traumatic event. The symptoms usually include recurrent, involuntary, and intrusive distressing memories of or dreams about the traumatic events in question, persistent avoidance of stimuli associated with the traumatic events, negative alterations in mood or cognition related to the traumatic events, persistent symptoms of increased arousal and reactivity. Moreover, all symptoms must be present for at least a month, and they must cause significant distress or impairment in social, occupational, or other areas. A big part of post-traumatic stress disorder is the replaying of the event. That is, individuals experience recurrent and intrusive recollections. These might take the form of images, thoughts, or perceptions. They will report acting or feeling as if the event was happening again, a reliving of the experience, also illusions, hallucinations, and flashback episodes. They'll report intense psychological and or physiological distress upon exposure to cues that symbolize or resemble some aspect of the triggering event. So who gets sick with post-traumatic stress disorder? Well, it occurs in about 8% of the population. 35 to 50% of all cases are found in victims of rape, in those experiencing military combat, in those who have been held captive, or in those who have lived through genocide. Post-traumatic stress disorder usually begins approximately 3 months following the trauma.